James came into A&E 3 days ago with severe abdominal pain and was diagnosed with acute pancreatitis. His pain was managed with a PCA machine, and every time he was sore, he pressed the button on his PCA and received a dose of morphine into his vein. It worked really well, and he felt secure that the painkiller was there when he needed it. This morning, the doctors told him that his pancreatitis was resolving and that they would change his PCA to oral oxycodone liquid, which is a painkiller similar to morphine. This drug was prescribed PRN, which means as required. PRN is an old-fashioned Latin abbreviation of pro re nata. The direct translation is as the circumstance arises, but in a busy NHS, PRN actually means patient receives Nowt. It's 12 o'clock on the ward.
Oh, this pain is getting really bad. I wish I still had that PCA. I hope the nurses are going to come around soon so I can ask for some extra painkillers.
10 minutes later.
I hate using this buzzer. I know the nurses are really busy, but I can't wait any longer. I need something for the pain.
15 minutes later.
I've been waiting ages. Did they hear the buzzer? Should I buzz again? I don't want to hassle them, but I'm really sore. I wish I was at home. At least then I could take my painkillers when I need them. This is torture.
Meanwhile, Abby the nurse is doing the drugs round. She's wearing the tabard that says, "Please don't disturb, drug round in progress." Well, that's a joke for a start.
I can hardly concentrate on this drug round. There are so many distractions. One of these days I am going to make a serious mistake. There are 4 buzzers going. I can't answer them until I finish the medications, otherwise it will never get done. I have to concentrate. I will ask Alan, our nursing assistant, to check what is going on. Alan, can you see what's going on? There are 4 buzzers going off. I need to finish this drug round.
It's really kicking off, Abby. Jimmy in room 10, who has a history of dementia and falls and is waiting a nursing home placement, is wandering to his room again. I think he's going to fall. James in room 15, the step down from critical care, says he's in agony. And Graham in room 7, the post-op hemicolectomy patient, is also really sore. And remember, Alice in room 2, the girl who came off her horse with a spinal brace, well, she needs the commode. She needs 2 to mobilise. I think she's been waiting ages.
Alan, first priority, can you get Jimmy safely back to bed on your own? I know he's a handful. Then, can you get the commode, please, Alan? I'll finish the last 2 patients on the drug round. Then we can help Alice to the commode. After that, I'll find Fiona from the other bay and we can sort out the 2 who need painkillers.
Come on, Jimmy, let's get you back to bed. We can turn the telly on. I think the racing's on.
Meanwhile, back with Abby.
I can feel a migraine coming on. There you go, Alice. Careful. Sorry you had to wait so long. It's chaos today.
Abby finally gets to James 45 minutes after he first pressed his buzzer.
Hi, James. How are you doing? Oh, you look sore.
I'm in agony. They stopped my PCA this morning and the pain has come back worse than ever.
I will have a look and see what painkillers are prescribed for you and get you something. I am going to be a few minutes because I have to find Fiona so we can check out the painkillers together. Oh, Fiona, there you are. I've been looking for you for ages. Do you have the keys for the controlled drug cupboard?
No. Oh, I thought you had them. Hector must have them again. Where is he?
Where do you think? He's probably still in the office talking to the discharge team about Jimmy and the other patients waiting for a social care bed. He spends half his life on the phone, either trying to sort out discharges or sorting out agency shifts to cover vacancies.
Oh, sorry, I had them. I'm just on the phone to social care. Hopefully someone can come out and help you soon.
I won't hold my breath.
Abby and Fiona go into the locked drug room.
James has written up for oxycodone 5 milligrams PRN. We can give him that.
I'll get the bottle. Here it is.
There should be 30 ml left in the bottle.
That looks like 30 mils. Can you check?
Yep.
I will draw up 5 mils. That is 5 milligrams.
Can I do a quick check, please, James? Can you tell me your name and date of birth, please?
James Milligan, date of birth is the 29th of the 4th, 1978.
James finally gets his oxycodone for breakthrough pain over an hour after he pressed his buzzer.
Okay, so to confirm, James has had 5 milligrams of oxycodone. Can you countersign? Thanks. James had 5 milligrams of oxycodone. That leaves 25 ml in the bottle. Can you countersign the controlled drug book to confirm that?
Oh, Fiona, whilst you're here, there is another patient, Graham, in room 7. He's also in pain. Can you help me check out some analgesia for him?
Sure. I don't know when I'm going to get my lunch break.
I know. This place is wearing me down.
You know, if the doctors had to do this level of checking for controlled drugs, they would have changed the system years ago. They wouldn't put up with this.
I know. We spend half our shift checking these drugs. It's ridiculous. When was the last time you had time just to sit with a patient who needed someone to chat to?
An hour later,
That pain is coming back again. I think I need another dose of painkillers. Am I going to have to press that buzzer again? My wife Sheila is coming in half an hour with the kids. I hope the nurses can get me painkillers more quickly this time. Sheila is going to be really upset if she finds me like this.
here's a recent thank you card sent to B3, which is one of our surgical wards. This patient highlights the problem with painkillers on a busy surgical ward so well. She says, "The only thing that I will not miss is the flippin' buzzer. As you know, I've put up with pain rather than press mine. I have felt so sorry for you all when it's constantly going off." Thank you to all the staff at Dumfries and Galloway Royal Infirmary who helped make this picture story.